We're delighted to be here this evening. So, welcome everyone to today's discussion on understanding pain and the mind body connection. Pain is a complex and personal experience, and learning how to manage it effectively requires not only medical interventions, but also an understanding of how our thoughts, our emotions, and our past experiences shape our perception of pain. Today, we'll explore some research, practical tools, and strategies to help our patients navigate pain more effectively. To do this, I am delighted to be joined by two of my esteemed colleagues. To my left is Emily Sirotkin. Emily is an adult care nurse practitioner. Emily has worked at HSS for over 10 years and is a valuable member of our perioperative pain team. Emily is known for her very thorough assessments, and she is just a wonderful clinician. We're also joined this evening by Ms. Meghan Shade. Meghan is the newest member of our team. Meghan is a licensed clinical social worker and has joined us to support our patients during their perioperative journey for psychosocial support. So thank you both for joining me this evening. So we're really excited about getting started. So let's dive right in.
Yeah, thanks for having us, Mary.
Yeah, thank you. Thank you both. So, understanding pain and the mind body connection. How do our thoughts and emotions influence the way we experience physical pain? And what does current research tell us about that relationship? So, Megan, would you like to kick us off here?
Yeah, absolutely. I feel like we should start this with a definition of
Mhm.
pain, too. So, the International Association of the Study of Pain really looks at pain as a negative sensory and emotional experience. So, emotions are right there in the definition of
Mhm.
pain. Psychology is a part of pain. Um, and if we look at where science shows us we process pain, it's in our brain and it's in our spinal cord, so our central nervous system. No matter what kind of pain we experience, right? So, acute traumatic pain like a broken wrist, or chronic pain like arthritis, fibromyalgia, or even if we stub our toe, we process that pain in our brain and in our spinal cord. What research has shown us now, though, is that we also process emotions in the same part of the brain that we process pain. So, emotions like stress, anger, sadness. And because they share this kind of real estate in the brain, we see that emotions influence pain and pain influences emotion. So, if we're experiencing really high stress levels, we recognize that our pain might also increase during that period, whether it's acute or chronic pain.
You're absolutely right. And I'm going to pick up on that with you, Emily, about stress and how stress levels impact our pain
hmm
and and especially during challenging emotional times.
hmm Yeah, and stress and pain go hand in hand. The stress hormone in our body is cortisol.
Mhm.
So when someone experiences pain, their cortisol levels increase. That sympathetic nervous system is kicking in, or many people know the fight or flight response. So that really is something that's kicking in when you are experiencing pain. And everyone reacts and everyone has a different fight or flight response when it comes to pain.
That is so true.
hmm
But I think we can also bring back that too to our past experiences
hmm
and past experiences of pain and how they shape our pain, our current pain responses. And what can we do from those past learned responses? Megan.
Yeah. So, pain, past pain experiences or traumatic experiences related to pain definitely influence how we interpret and perceive pain in our everyday current lives.
Mhm.
Um, Often, these past experiences create what we call pain memories. My go to example is when we're young. I'm sure we can all remember a time when we first touched like a hot surface we weren't supposed to. Maybe it was a stove top.
Mhm.
I bet after that first time, we never did it again. And that's because we created a pain memory associated with that. The unfortunate reality of experiencing chronic pain conditions is that we're experiencing pain often, right? So we're having this
Mhm.
kind of cyclical experience with pain, and we're creating something that's called an unhelpful pain mindset. And so, what that looks like is we might have thoughts related to our pain, even if we're not experiencing pain, like, wow, my pain will just prevent me from doing anything I want to do in my life, or because of my pain, I can't do the work I want to do, or my pain's going to make it even really hard for me to wake up tomorrow to go on a walk with my grandkid like I had planned.
Mhm.
The good news is research does show us that we can reverse the effects of pain memories and help combat the pain mindset with things like mindfulness or cognitive behavioral therapy.
Yeah, that is so true. And that's what we're going to address this evening.
Mhm.
Part of the strategy to come up with chronic pain as well is the stigma that surrounds chronic pain
Hmm.
and patients' experience with stigma. What can we as healthcare providers do to address the barriers to care for patients who feel they're stigmatized because of their chronic pain?
Hmm.
Emily?
Yeah, and unfortunately, there is a stigma associated with chronic pain. As a provider who cares for patients who have chronic pains, it's very important to let the patient know that their pain is real.
Mhm.
They are the expert in their own pain, and I encourage them to share their story, their full pain history with me so I can get a detailed history and we can come up with a good plan for them. But there are many misconceptions that pain is not real. And pain, for instance, is in someone's head, which we know for certain it is not.
It absolutely. And Megan, anything to add to that?
Yeah, with the experience of pain and these misconceptions associated with pain, we want to make sure we address them head on and
Hmm.
we validate a patient's experience. So you mentioned, pain is in my head. Is that real or not? No, of course not. Pain is processed in your
Hmm.
brain, like we talked about, but it's a very real and valid experience. And you are the expert, and we want to get to know things from you directly.
And I think other misconceptions is that stress doesn't affect pain. I think we're discussing. We
Hmm.
know it does.
It certainly does.
It
Yeah,
definitely does.
stress actually directly impacts things like inflammation. Nerve pain can be activated by stress as well.
And the other thing is, if you can't see the pain, it's not real.
That's false. We all know it is, neuropathic pain, arthritic pain. We all know that that is very much real, even though you cannot see it.
And I think one of the most other misconceptions we hear about actually in our practice is pain medications are really the only way to manage pain. Your thoughts?
We disagree.
Yeah.
So pain medications are absolutely a tool that should and can be used to manage pain, but there are many other things we can
Mhm.
do to manage our pain on the day to day, including physical therapy, including again mindfulness practices, cognitive behavioral therapy. We're big fans of that multimodal approach.
Absolutely. And actually that segues us perfectly into our into practice tools and into something we use here at HSS and we're really proud of, which is empowered relief. So, Megan, would you like to walk us through the components of empowered relief?
Sure. So, Empowered Relief is a wonderful class that we teach here at HSS, and all three of us
Hmm.
are now trained in how to teach it. So, Empowered Relief it's a single session, 2-hour course where we focus on teaching individuals different skills they can take away in order to apply them to their daily lives and improve their experience with living with pain, whether it's chronic or acute. So, empowered relief takes something that's called cognitive behavioral therapy, which is a therapeutic intervention most often used to address pain in the mental health sphere of things.
Mm.
And cognitive behavioral therapy, or CBT, focuses on how our emotions, our thoughts, and our behaviors are all connected, which is very relevant to our pain experience, as we talked about. Emotions and pain go hand in hand. And so we take what typically is usually an 8 to 16 week long intervention with a trained provider, and we condense it down into a 2-hour session. It's completely free.
Mm.
It's online, so it's even more accessible. And we hope by the end of the class, you're taking away, a background in the neuroscience of pain. You're taking away skills and tools to create a personalized plan for addressing your pain. And that includes things like mindfulness, meditation.
And that's mindfulness is actually my next question. So, Emily,
Mhm.
mindfulness, What mindfulness techniques have you employed for that you find most effective for patients who are acute postoperative pain?
hmm And I've been here for over 10 years. I've seen plenty of postoperative patients. And what I really find very helpful for mindfulness and relaxation really are breathing exercises.
Mhm.
One specific breathing tool or breathing exercise that is very useful, anyone can do it, is called box breathing. So if you visualize a box or a 2D square, just follow the square. So 4 seconds inhale, 4 seconds down as you're holding your breath, 4 seconds tracing on the bottom, you're exhaling, and then the 4 seconds coming up that box is another hold. And you're going to continue that loop again and again until you feel like you have reached a relaxed state that is now your pain is under control, or at least at a level that you're happy with.
I love that technique. It
Mhm.
helps me sleep at night, actually. It's really
Yes,
good.
it's
It's
very,
really
yeah,
good.
no, it helps a lot for sure.
And Megan, how about mindfulness technique for chronic pain? Somebody's more persistent pain.
Yeah, absolutely. What's great with chronic pain is you can use breathing exercises just like box breathing too. But for chronic pain, we definitely encourage even more active mindfulness techniques. One of my favorites is guided meditation or guided imagery. This is a practice you can incorporate in daily life. And what I appreciate the most about it is it's so accessible these days. There's wonderful apps online where a provider or a teacher guides you through a meditation, but they're even on YouTube now, very easy to find. Um, and what's great about guided meditations is someone is helping you take a moment to kind of get away from those external stimuli, to really process in the moment how you're feeling, right? Without judgment. So understanding where your pain level's at, understanding what you need to do to hopefully release tension in your body and to find a more calm and peaceful moment in your day.
That is absolutely true. Following on that, I think another very important component is actually sleep and sleep management and how it impacts pain management. So, Emily, what techniques can patients use to improve their sleep quality?
Yeah. So sleep is extremely restorative, and we really want to make sure that patients have a good night's sleep, which really will help with their pain and also coping with their pain. So, you, throughout your sleeping cycle, there are multiple restorative processes that occur. There's tissue healing. Your immune system will also be helped by you sleeping well. And also, sleep hygiene is extremely important to note on. So, sleep hygiene actually starts during your waking hours. So, you want to make sure maybe you don't sleep too late, right? Open up the curtains, get some sunlight in, go for a walk, do some exercise throughout the day to get your, cardiovascular system up. Make sure you don't have caffeine too late in the day. Make sure you limit your, caffeine, your coffee intake. Go to bed at a reasonable hour. Maybe set an alarm that this is my bedtime. I should really shut off the TV. I should go into my bed. And I know me personally, I often have thoughts and my to-do list is swirling around in my head. So I like to keep a notebook at my bedside. So I jot things down. I jot things on my to-do list or what I have to do. So it's not just constantly swirling around in my head, and I can finally get some good sleep.
This really is. That's great advice, Emily. Very solid advice there. In the ad, Megan? That's
No,
the
I need to
journaling.
start doing that,
Yeah.
honestly, because everything's going to be there tomorrow. So
Exactly.
I'm guilty of the social media scrolling. So,
Mhm.
being mindful about putting my phone away, because not only is the blue light affecting me and keeping me more
Mm-hmm.
activated,
Mm-hmm.
but social media these days are meant to kind of like draw you in. And the stimulus is just, it could ramp you up when you're actually
Mhm.
trying to
Absolutely.
prepare for a healthy sleep.
Yeah.
Okay. Something else the patients can do if when they see us as providers, how can
Mhm.
they effectively communicate their pain to us that we can come up with the best treatments to help them, that we can understand their pain and help treat them?
Mhm.
Um, who'd like to start?
Yeah,
Emily, start off.
sure. So I back to obtaining that thorough history. So I want to know everything. So I want to know about your pain. When did it start? What exacerbates your pain? What helps the pain? What makes it better? What time of day is your pain worst? And what time of pain? What time of
Gotcha.
day is your pain at its best? And really, I'm going to ask a lot of questions throughout this whole intake because I really need a thorough history to help best come up with a plan with you for your pain. It's just very important to know and be able to not, I'm going to ask what a pain scale, 0 to 10. If you can't, give me a number. So mild, moderate, severe, we'll start with that.
Mhm.
Characterize the pain. Is it sharp, shooting, dull, achy, throbbing? What are some modalities, again, that help with the pain? And so we'll go from there.
Because at the end of the day, you're the expert in your pain experience,
Mhm.
right?
Yeah.
And so
Mhm.
our goal is to better understand what you are living with on the day to day.
Absolutely. Yeah.
Mhm.
The patient is, what you experience, and our goal is to help you and partner with you on your journey.
Correct.
Mhm.
Absolutely true. So moving along here with pain management
Mhm.
and plans and
Mhm.
expectations. So, what should patients expect regarding pain before and immediately after surgery? And how can they best prepare mentally and physically?
Mhm.
So, physic-
Let's
physically,
do
Okay.
physically
Emily, let's,
All
first.
right.
let's do
Yeah.
So
physically
physically,
first.
yeah.
Yeah.
So I'm not sure if everyone has heard of the term pre-T. And pre-T means the physical therapy that you do prior to a procedure. And this really gears you up for the PT exercises that you'll be doing after your procedure, and also, helps your muscle systems get used to, how to use a walker, have core strength. All of these things will really help. So you really have the best recovery as you really can
Mhm,
after surgery.
mhm.
Um, also realistic expectations, knowing that you are going to have surgery, pain is going to be elicited with this procedure. So have realistic expectations that it's a procedure at the end of the day. Expect some pain and know what your tolerable pain level is. So if
Absolutely.
your tolerable pain level to, function and do your activities of daily living, let's just say is a 6 out of 10, and you think that maybe a 7 out of 10 is tolerable after surgery, I like that you're thinking that way. I like
Mhm.
that you are thinking, yes, right now my tolerable is maybe a 6. After surgery, I'm going to raise it up a little bit because I am anticipating some pain as well.
Correct.
Yeah.
That is so true.
Hmm.
And I think the physically, and then the other portion is mentally, Megan. How can patients mentally prepare for upcoming surgery? Because it is nerve wracking.
Hmm.
Absolutely. And we recognize that it
Mm-hmm.
is normal to feel anxious when
Mm-hmm.
coming into surgery. It's normal to be concerned about pain
Mm-hmm.
after surgery. And it is very important to start the mental preparation with having realistic expectations of what your pain is going to be like. It's also really important to start preparing coping mechanisms to use in addition to pain medication, post op physical therapy or occupational therapy. So, we want to make sure our mind is in a healthy space as well, setting boundaries if we need to with family and friends so we can focus on our recovery, knowing like, if I queue up this TV show, it's going to distract me when the pain is kind of high and I'm waiting for other things to help address the pain.
Hmm.
So, having kind of active and passive coping mechanisms, telling your family and friends you're having surgery and calling them when you
Mm-hmm.
need to and leaning on them.
Hmm.
Then that's absolutely great advice. So, what strategies can patients use to manage post surgical pain?
Mhm.
And how does this differ from managing a chronic pain condition? So,
Hmm.
let's touch on post surgical pain initially. What strategies can patients
Yeah.
employ
So
themselves?
I was actually listening to a webinar earlier this week, and I caught on to a quote that I actually love. And it's motion is lotion.
Oh,
So you gotta walk to really gain that, the lesser pain. You really have to make sure that movement is medicine. And
mhm.
you have to reiterate that mantra in your head because it might seem counterintuitive that if you're in pain, you're going to get up and walk around in the hallway. And no, I'm in pain. I want to lay in bed. But that's actually the worst thing that you could do. You really have to not only physically get up, move around. Motion is lotion, get those joints nice and, y- um, you know,
Lubricated, worked on.
lubricated,
Yeah.
worked on, but also mentally, just, getting out of your
Mm.
bed and just kind of walking around, you're also going to feel better about yourself.
Mhm. I think the favorite part of my job was at night when I would see patients the evening after surgery and they'd
Mhm.
stand for that first time
Mm.
on their new joint or whatever. And it was just, that felt great. And it was like, it's over and now it's time, and projection is time and healing and moving on,
Correct.
so it's really good.
Yeah. And along with, moving, all ice therapy. We love our
Love
ice
ice.
here.
Ice
So
is our
really,
best friend.
Ice.
so I always encourage, if I don't see ice packs, I always encourage, let's get some ice packs on that site.
Absolutely.
Mhm.
And Megan, for chronic pain strategies.
Yeah. So for chronic pain strategies, movement is also important. Ice
Mhm.
therapy is also
Mhm.
important. What's great too is to protect, again, that mind body connection and to touch both places, right? So post op physical therapy will also come into play. You can use physical therapy with chronic pain conditions, though, too, to hopefully see improvement and strengthening. And then there's other techniques like engaging in cognitive behavioral therapy, connecting with support groups, connecting with your
Mhm.
community providers.
Absolutely. Yeah,
Yeah.
that's all very important factors. And how about what factors should patients consider when setting realistic expectations about their specific condition,
Mhm.
like recovery after surgery?
Mm-hmm.
Well, I love realistic expectations. I love whenever it's brought up. So shout out to that. But I really want to, when I see patients prior to surgery, for instance, actually, even if I see them after surgery and they're saying, why am I having pain? My friend wasn't in pain, for this type of procedure. I say, don't compare yourself. I don't even like when patients compare themselves to themselves, an earlier version of
True.
themselves at a different time. You've different, um, health,
Different experiences.
different experiences, but also don't compare yourself to your friends or your family members. You can, of course, listen to them and listen to what they went through. But I always say, this is you, you're an individual. Look into what you think is tolerable and
Mhm.
look at your different, options that you can take to help yourself.
That is so true.
Mm-hmm.
Absolutely. So when we're talking about pain management techniques, what signs can patients look out for that indicate a pain management strategy is working? And how long should patients typically try a new approach
Mm-hmm.
before evaluating its effectiveness?
Yeah. So some of our pain providers have these 3 questions that I love. And so, in order to see if a pain strategy or a way to approach your pain is working, we have these 3 questions. One, is there a decrease in the intensity of my pain? 2, is there a decrease in the frequency of my pain? And 3, is there a decrease in
Duration.
Duration
duration?
of
Yes.
pain.
Almost
Yeah.
forgot it. Duration of my pain. So those 3 things are really important to pay attention to. And it plays in differently for post-op acute pain, I think,
Mhm.
and chronic pain. So post-op acute pain, you might be asking yourself those 3 questions on like a 4-hour basis initially, and
Yes.
that's okay. But give it a day and continue to assess day by day with post-op pain. With chronic pain conditions, though, it's still important to kind of check in as you're starting to use things like meditation or you're starting to do physical therapy for the first time. Check in, every day, then every week, and then every month, and see the larger picture too. Keep track of it in a journal, even, or utilize the resources in the community you have to keep track of it too.
Mm-hmm.
And actually, that opens up to resources and support. And what do you recommend for patients to maintain their progress and handle any potential setbacks in their pain management journey?
We have so many resources available to us. And I think, each individual person can have the professional resources. So you have things like outpatient pain management providers, you have primary care providers, physiatrists, oh my gosh,
Rheumatologists.
rheumatologists. Thank you. You also have things like mental health providers as well to kind of check in and mark those progress. Your physical therapist, you're going to set goals with them in
Mhm.
session number
Absolutely.
1.
Mhm.
So you'll be able to see week by week, how are you progressing towards those goals? And they can provide you with that feedback as well. And before I forget, post-op surgical pain, number one resource is your surgical team.
Correct.
Mhm.
And let's go specifically for HSS. What other resources does HSS offer, and how can our patients learn more about those resources?
Well, we've already plugged it once, but I'll plug it again. We've
Well,
plugged it a few times. Well, we have Empowered Relief, which is a class that we teach, the three of us, but once a month, Empowered Relief, you can be referred by an HSS provider. So any HSS provider you're connected with can refer you. There's also wonderful webinars like this one.
Mhm.
We were listening to a couple in the office recently about, gut health, about
Acupuncture.
acupuncture, restorative medicine, and there's an upcoming one that I think we touched on.
With
Claudia touched on, right?
Mhm.
with our
Our
physician,
attendings,
our
yes.
physician
Yeah.
colleagues, yes.
Our colleagues
Mm.
will have one in just a couple weeks talking about pain medication.
Mhm.
But HSS also has exercise classes. They have a yoga workshop coming up that I think
Mhm.
Claudia will touch on too, which is
Yeah.
wonderful,
Mhm.
connected to that mind-body experience even more.
Because really, our role here tonight was about mind. Like we're clinical clinicians, but we're also very much in tune with the mind-body experience, and I think that's what Empowered Relief
Mhm.
has given us. Because I love that name, Empowered Relief. It's empowering you, the patient, and we're here as your advocates and your
Mhm.
allies on your perioperative pain journey,
Mhm.
and that's
Yeah.
what's really important, right?
Mhm.
And
Yeah.
don't dismiss like your other community-based resources,
Absolutely.
right? So number one, family, friends, your church community, your spiritual community, your book club,
Yeah.
AA, NA, and also support groups, which HSS also has support groups related to lupus, related to arthritic conditions. So those are available too. There's more information online too.
Okay, that's really great. So I think we're going to open up. We just give like an overview. So I think we should
Mhm.
open up to some audience questions.
Great.
Okay. Could you please discuss insurance providers' willingness to or denial of coverage for other multimodal therapies for treating pain other than medication? Good question.
Absolutely.
Mhm.
Good question.
Yeah, we recognize insurance can sometimes be really helpful in accessing some of these multimodal therapies, but more often there is instances of denial of certain things.
Mhm.
So, depending on the type of insurance you have, my number one recommendation to any patient I see preoperatively or even while they're here in the hospital, most insurance companies have an online portal now where you can log on and see what providers are covered. And you can even put very general search terms, which I find helpful. So I can say like chronic pain, mental health, and someone will pop up. And there's also other online resources, there's support groups, there's chats that help you navigate insurance a little bit better.
Mhm.
So don't hesitate to look into like some of those online, like through Facebook, Reddit, those kind of avenues to see what kind of recommendations. Mental health services, so cognitive behavioral therapy, they're becoming a lot more covered averagely by
Yeah, I think
insurance.
insurances are starting to open up to
Mhm.
And
cover some.
physical therapy.
Yes. Yeah.
Physical therapy, whether you have chronic pain conditions or again, you're preparing for surgery or post op recovery, that is becoming better covered by insurance as well.
That is so true.
Yeah.
Absolutely. So another, let's go to family. What role do family members and caregivers play in supporting a patient's pain management, and how can they assist with the recovery process?
Yeah. So
Mm.
I'll see patients pre-op and they bring their family member with them. And I think that's very important. It's good to have, two sets of ears, two sets of eyes listening, because sometimes it's always some information can just, slide right by you.
Yeah.
So I think it's important that a family member or a friend, if possible, can come with you to maybe some appointments just so you have another person there to kind of take in the information. And of course, it's always important to open up with them the pains that you are experiencing yourself so that they are also a sound board and they know if there's a procedure coming up, let your family friends know. They can give you a call. They can again keep you distracted like we had discussed, different ways of, keeping your time busy is, other people calling you, FaceTiming you. So I think that's
Distraction is key.
distraction. Yeah.
Yeah.
It takes a village.
It
Mhm.
takes a village.
It really
takes a
does.
village.
It really does.
I know I know we aren't discussing medication specifically, but at what point do we know if we should consider pain medication in addition to mind-body practices? I would actually say mind-body practices and then consider medication, but
Oh, yeah. And I think I understand where the question's coming
yes,
from. Where should we, if we're practicing mind body exercises, if we're doing
correct.
the PT, this goes back to that question of tolerability.
Mhm.
So, can we engage in activities of daily living? Can we engage in these alternative methods of managing our pain at a tolerable level? And if that tolerable level is becoming much more difficult, if our pain is continuing to increase, we're not as functioning as safely, the best thing you can do is connect with your primary care physician
Mhm.
first.
Correct.
They're the ones who hopefully know you best. They're the ones who can help with referrals and guiding you further on that conversation about medication specifically.
Mhm.
And if they can't, they'll refer you to someone who can.
Okay, while Empowered Relief is only available at HSS at this time, is it possible to schedule pain management appointments at HSS? Participants specifically asked about scheduling a session to discuss their pain history. I think you probably need to reach out to the hospital directly.
Mm-hmm.
Our website has a plethora of information, and I'm sure you can plug in your information there, specifically what your pain management issue is. We're a musculoskeletal and rheumatological hospital. I would just look at our website and see whether there's some information and
Yeah.
perhaps I would also go to your primary care and see if you need a referral.
Mhm.
Yeah. So I know a lot of insurance providers do require referrals. So it's always good to start with your primary care physician to see if that's needed for insurance purposes.
Mhm.
But HSS has so many wonderful providers of very different degrees too. We're not just surgeons here, but there are great physiatrists, rheumatologists, and
Correct.
you connect with one of them. You connect with Empowered Relief, no problem.
Exactly.
Yes. And
Exactly.
us here, we are a consult service for the inpatient pain service.
Yeah.
That's true. Yeah,
Yes.
we do have an outpatient branch, but we're the inpatient service
Correct.
of the hospital.
Mhm.
Are there any specific mindfulness programs that you suggest?
Oh, there's so many.
So
Okay.
many.
I would say the easiest way to start, if you want to have a variety of things to try, is actually to start on YouTube. It's so
Yeah.
silly, but like just typing in mindfulness will open up so many opportunities and give some more education on it too. Meditation is a component of mindfulness, but there's even such a thing as mindful eating, believe it or not,
Yeah.
where you can take a moment while you're eating a meal to be very intentional and aware of what you're doing, what you're eating, how it's nourishing you. And the way I found that out myself, even though I'm a social worker, is through Google, through YouTube. But then there's also wonderful apps. I know we talked about this
Yes.
before, Mary. Calm app.
Yes.
Super helpful. We both use
Yes.
it. Even on Spotify now, they have meditation and mindfulness exercises.
And what's also great about the Calm app, even I use it, is there's different times. So if you only have 5 minutes, maybe you're commuting and you just have 5 minutes to just really give to yourself that morning, that's fine. Every little bit helps. And download that Calm app and just listen for 5 minutes, because they do certainly have different lengths of, meditations or whatever the course
I
is.
think that some of it is free and
Mhm.
others you have to pay for, but I
Yeah.
think the free portion is just fine. And
Yeah.
there's the world that we live in, there's so much on apps and podcasts. Like there's a plethora of information out there. There's so much information out there.
So
Yeah.
find something approachable to you. Yeah.
Mhm.
Are HSS clinicians throughout the system familiar with Empowered Relief? Will they know to refer me?
So some are.
Some are.
Some are. We're still working on it.
We're working on it.
So we're still putting out more and more information about Empowered Relief, even here at HSS. If you connect with a provider and they're not sure what that is, that's okay. They can put you in touch with the perioperative pain service. So that's us. And you can even give them one of our names, and they can help connect with us and do a referral.
Okay. Can you compare CBT and ACT models for chronic pain help? So cognitive behavioral therapy.
Yeah, I will. Again, I don't want to speak too out of
Mhm.
turn. I'm trained in cognitive behavioral therapy related to pain management, but also outside of it. ACT is a model I'm not trained in as much. Have I heard and seen a lot of great research on it? Absolutely. Um, and I think it depends on your availability and ability to connect with providers who are trained in those models. One might fit more for you and your lifestyle. CBT is a big fan of homework. Um, ACT, I'm not as familiar with, so I don't want to speak too out of turn, but I've heard great things.
Okay. And is empowered relief available to pre-surgical patients?
Absolutely.
Absolutely.
You're our
That's our
ideal
target.
clientele.
Yes.
Yeah, we hope, in offering empowered relief, right now it's once a month. The hope is you can attend before surgery. You can also attend after. But the hope is you use some of the skills that we teach in empowered relief and you approach and come to your surgery with your personalized pain plan, so you can utilize it while you're hospitalized or during that initial post-op recovery period.
Mhm.
Okay.
Yeah.
And thoughts on acupuncture for pain? Absolutely. We actually watched acupuncture talk that was done by Dr. Stephanie Chang and Dr. Chris Lee of HSS. It should be on this webinar program series, so strongly recommend you go back and watch that. And absolutely, they're actually doing acupuncture doing the intraoperative phase, so very interesting. So I would highly recommend that webinar to watch.
Yeah.
Okay.
Great resource.
All right. So I think we're at the end of our questions. So thank you. Thank you very much. Today's discussion highlighted the relationship between the mind and body in pain perception and management. We explored evidence-based practices like empowered relief, mindfulness techniques, and I think the importance of clear communication with healthcare providers. Pain management is definitely not a one size fits all, and each patient's journey is unique and specific to them. By understanding the psychological and physiological aspects of pain, using effective pain tools, and setting realistic expectations, patients can take an active role in their pain management. I'd like to thank my panelists here, Emily and Meghan, for joining me today, for their insights, and for our audience for your engagement. Thank you very much for your questions. For those interested in learning more, we encourage you to explore the resources offered by HSS, including Empowered Relief and other patient support programs. And thank you very much for joining us today.
Thank you.
Have a good evening, everyone.
Thanks,
Mary.
Mary.
Thank you, guys. It's great. Good job.